Good evening, ladies and gentlemen. You're very, very welcome to the December lecture. And our speaker tonight is Lisa McGeeney, who is going to speak to us on health during the time of the poor laws in County Tipperary.
Thank you. Thank you very much to Mary and to Jane and to all of the team here in Tipperary Studies for inviting me here this evening. As you see there, my background is I've trained as a nurse and a midwife and a public health nurse, and I currently work in the area of child health and welfare and development. But I also love history. One of my favourite historians happens to be a Tipperary woman, Maria Luddy, and I'm sure she's very well known to everybody here. And she is a great champion of Irish women's history, and it's 20 years ago since she said that women just hadn't been written about. And I think in that 20 years, there's a lot of people have tried to fill that gap, and I'm hoping that my little bit of work is maybe contributing to that as well. So mostly when anyone thinks of the poor laws, we generally think of the workhouse. And that's what I thought of as well when I was doing the tours in the workhouse in Portumna. But part of the tour would be to point out this building out the back and say that was the infirmary. And that when the workhouses opened initially, it was inmates of the workhouse did any nursing that was there. And then as time went on, that progressed. And it's kind of that story intrigued me. And it's a little bit of what I'll be talking about tonight. In public health and the poor laws, there is women and men. So there was a lot of medical officers. I'm not really concentrating on them tonight. It's more the nurses and midwives, because the period of time I'm talking about is a time where we transfer between unqualified nursing and midwifery staff to qualifications, and what effect that had on outcomes for people. So we're going to look at that. So I'll be looking at three main areas tonight. It'll be the dispensary system, which I suppose became our modern GP system. I'll be looking at the infirmaries in the workhouse, which are actually the basis of our modern healthcare and hospital system. And I'll be looking at the Women's National Health Association, who funded public health nursing, and we're looking at tuberculosis. So I hope that's what you thought you were coming for tonight. So that's what we'll look at. And so I'm going to talk poor laws, but before you get to the poor laws, so before we get to 1838 and the poor laws for Ireland, there was medical relief for the poor. And it mightn't be something we think of when we think of healthcare, but that most medical institutions were actually charitable in some way. They were set up for the poor, not for the wealthy. So, and you start seeing from, say, the early 1700s there, charitable hospitals and voluntary hospitals. The oldest running maternity hospital that's still operating in the world is the Rotunda, opened in 1745, and not for the wealthy of Dublin, but because we're talking the 18th century and very high levels of prostitution, and we're talking very high levels of poverty, and so that's why the Rotunda was opened. And you have specialist hospitals, so you have psychiatric hospitals. There was one hospital called Simpson's, and it was for gouty and blind men, was the reason it was opened. I think it still exists, and it's an elder care facility. You then get houses of industry. So there was 9 towns in Ireland that had houses of industry. In Tipperary, we had one in Clonmel. So if you like, they were the precursor of the workhouse that would come later on. And the idea was to have accommodation for people who were homeless, or as they said in Dublin, the strong beggars and vagrants. They were trying to get them off the streets. The idea was that you'd have accommodation and maybe teach some work. The House of Industry in Dublin very quickly became Dublin Foundling Hospital, and they ended up having to build another House of Industry later on. And then we get county hospitals. So Cashel had the county hospital for Tipperary, but as anyone who wrote about the county hospital said, they really were only of value to the people within about a 5 or 6 mile radius. So I lived just outside Nina, so Cashel wasn't going to be any good for the people near Nina, and I'd say it was hardly any benefit to the people of Thurles either, because of difficulties with travel. But there was one county hospital in every county from about the late 1700s, and you start getting then the psychiatric hospitals, or what they called asylums, and then the dispensary system. So in 1805, there was legislation that set up sort of funding stream, so that the grand juries, through the grand jury presentments, as well as voluntary funds, that areas could set up a dispensary where there would be a medical officer and sometimes a midwife who would provide medicine and medical advice to the poor, because they decided at this time that the hard-working poor would benefit very much from being looked after when they were ill, because then that would get them back into the workforce quicker, but also it stopped them becoming destitute. So the dispensary, but the problem with the dispensary system, for the 1805 dispensary system, was that it really was only established in areas where there was people who had enough money to establish it. So the very poor parts of Ireland didn't have them. We had quite a number of them in Tipperary, and that system would be I'll be talking about that later, because that expanded after 1851 in the Medical Charities Act. And then we had fever hospitals. So from about 1816, you start having fever hospitals in quite a number of towns in the country. So we have fevers like cholera, typhus, various fevers that would come into an area and cause a lot of devastation, and they didn't know anything in 1816 about infection control and hand washing, but they knew that if you kept sick people away from well people, there was some chance of not spreading disease. They also knew that whitewashing buildings was good, and the lime has an antiseptic effect, but they knew that by keeping walls clean, by filling in cesspools. So there was boards of health established around this early 1800 period, and they would go around, and that's what they would do. They'd fill in cesspools, and they'd whitewash cottages, and then they set up these fever hospitals. So there was something before the Poor Laws come along. And then specifically, so this is some of those institutions. So you have Westmoreland Hospital in Donnybrook was what they call a lock hospital. So I think initially set up for people with leprosy, but it was also for women and children with venereal diseases. That's what a lock hospital was. I couldn't find a picture of Cashel County, the county infirmary in Cashel, but there's the same period. So it probably looked something like that. That's the Galway one. This is an early picture here of the rotunda. That's the rotunda. And then that one is part of the Dublin Foundling Hospital, which had started its life as the House of Industry in Dublin, which is on the site of where St. James's Hospital is now. So you can see how we've got that history. It became the site after the Foundling Hospital. It became the site of the Dublin South Workhouse, and now it's St. James's. So there's been something there from the early 1700s. So then specific to Tipperary, so the great thing about coming here to talk tonight, so I did my master's, I looked at how nursing and midwifery developed under the Poor Laws in Nenagh and Bersacain, but Nenagh and Bersacain are only two of the unions in Tipperary. So I haven't got all the details for every union in Tipperary, but some of the first public health in, I suppose if you call it this modern era in Tipperary, included the county infirmary that I mentioned there, so that was opened in Cashel in 1768. Again, it's only really very much for poor people, and what you find is that the nursing that was going on there was poor people who had been patients, and when they're ready to leave, they've no home to go to, and they stay on in the hospital, and they do things like wash the floors, set the fires, they're making the beds, they're feeding the patients that need feeding. They don't have nursing qualifications, they're doing really housekeeping type work, and it's for bed and board themselves. So this is what was happening in the county infirmaries at that period of time. You did have doctors, and you had doctors that in Ireland are getting quite skilled at this stage, but we didn't have a cohort of qualified nurses. From 1802 to 1835, in Tipperary, we had fever hospitals in Bersacain, Nenagh, Roscrea, and Tipperary Town, and then a fever hospital that also had a dispensary. We had Cahir, Carriganshore, Clogheen, Cloughjordan, Clonmel, and Templemore, and then there was a dispensary in Capper White as well. That's before 1835. There were more dispensaries opened between 1835 and 1852, but I haven't got them all there. So you have Clonmel Infirmary opens in 1829, the Clonmel Asylum in 1835, and then by the time you get to the second wave of workhouses being built in the 1850s, we have 5 unions in Tipperary, and with a workhouse in each, and each with an infirmary. So that's the basis of where we're starting with healthcare then once we get into the 1850s and the Poor Laws. There was also private healthcare, so whether you were very poor and you just helped your neighbours, and if you look at the Ducas, the school's collection, and you see all the folklore treatments. So people sometimes they relied on blessed thorns. They relied on using herbs, which are probably the basis of a lot of the medicines we use now, or other folk cures. But there was also midwives working privately. Some of those were qualified and some weren't. They might have been a neighbour or a woman who had that experience in an area. But you also see women at this time advertising their services and using very fancy terms like accoucher, or they're available to hire for your accouchement. So there's some the ads in the papers are fantastic. And then you get to see them advertising themselves as well as maternity and monthly nurses. So there was people working privately as well as those who were available to the poor. Now, so I've mentioned the Poor Law. So the Poor Relief Ireland Act, 1838, was passed, and that established a poor law for Ireland, very similar to one that was enacted in England. And it divided the country into 130 poor law unions, and each union got a workhouse. And with that workhouse, there was an infirmary. And then we get the famine, or the Great Hunger period, and they realized that the workhouse system they have isn't able to cope with all the people that are flooding in. And their answer to that is to redivide that whole area and put in 33 more unions and build 33 more workhouses. Well, the first of those new workhouses are really only opening by 1851, 52, by which time the crisis has passed. And from that time on, the workhouses really are rarely ever full again. And by the 1870s, they say a third of the people going into the workhouse are using it for the hospital part. So by 1870, we have a third of the people, and I think I have a graph later on. I think by 1920, when they're almost finished, you have the majority of people are there for the hospital part. So just for a map of Tipperary, so you get your Borrisokane was one of the new poor law areas that was established in the 1850s. You have Nina, Roscrea and Thurles. And some of those unions bring in parts of Laois and parts of Offaly and parts of, Parsonstown had part of Tipperary until Borrisokane was formed. And then in South Tip, sorry, it's not very clear, we have Tipperary, Cahir, Clogheen, Clonmel and Carriganshore. And obviously Carriganshore has parts of Kilkenny and Waterford in there as well. So the poor law unions weren't cut along county lines. They're unions of parishes, and they were civil parishes. So, but if you felt you could only use the facilities within, you were meant to use the workhouse was generally in the county town, and you used the facilities that were in your own poor law union. So some of you will recognise, this was, it's St. Joseph's Hospital in Clonmel. I'm sure it has a more modern name now as well. Clonmel had an old workhouse. This is where the House of Industry was here. So when the poor law union started, the Clonmel didn't need to build a new workhouse. They opened before anybody else did because they already had the House of Industry. But then that House of Industry needed to be replaced, so they built a new workhouse up here, and the new workhouse is the hospital, or part of it. They've obviously built onto the hospital since then. And then you had the asylum next door. So that's Clonmel. And then in Nina, so that anyone that knows Nina, that's the modern hospital in Nina. So the main buildings of the workhouse in Nina would have been burnt down during the Civil War. But the part that wasn't burnt down was the infirmary here at the back. And that continued to operate until they built the new hospital in the 1930s. At this stage, by the time these buildings were being burnt down, I think there was only maybe 11 inmates left, and then they were sent to Thurles. But the part that was in use was the infirmary here, and then there's the fever hospital. So you had the main buildings of the workhouse, an infirmary and a fever hospital. Now, so then I mentioned the medical, sorry, I've got the wrong date there, that should be 1851. So Medical Charities Act. It looked at the poor laws and said, okay, you've got infirmaries there. There's people in the workhouse were the only people who could attend the infirmary. So the Medical Charities Act opened those infirmary hospitals of the workhouse, and they opened those to the destitute poor. And by 1862, they opened them to the general public. So by 1862, the workhouse infirmary had become a de facto district hospital. And then what they also did is they reorganized that dispensary system that I mentioned so that we get a lot more dispensaries, and each dispensary district gets a medical officer. All of the infirmaries have medical officers, and the problem they have is they don't have nursing staff. And this is one of the big problems with the infirmaries. They're using paupers, no nursing training, mostly not interested in the work either, especially if they're sent to the fever hospital because they don't want to get sick themselves. And I saw in the petty sessions for Nina at one stage 3 pauper nurses were brought up at the petty sessions for refusing to look after patients in the fever hospital. Yes, so it wasn't an ideal system, and it was one of the complaints that's made when we start getting a lot of reformers sort of pushing to have, we need qualified staff, we need to do better by the patients, we need qualified midwives in the community to stop all the terrible things and the deaths of mothers and babies in the community and the spread of infection. So we need qualified staff. So some of that is coming from reformers who actually want better nursing, but they also want better opportunities for employment for women. That's also part of it. But the pauper nurses become they become the worst part of the whole system when we're talking about the infirmaries. So before these are some of the ads. So I think you get an idea of, this is Bursalee had a dispensary, and this is from 1852. So it's looking at, so in the year, so this is kind of their annual report, if you like, or a synopsis of it from November 1839. Within the last year, the institute they looked after 3,000 poor people. That included 230 cases of fever, 146 of affections of the chest, 147 of diseases of women, 19 of croup, and 83 of affections of the eyes, besides cases of every other complaint and wounds. So 3,000 people in that dispensary. So they were busy. There was probably one doctor. Was seeing all of those. And then this is the annual report, if you like. It was in the Nina Guardian for the Nina dispensary from 1840. Now, what's important down here, these are all the people who are subscribing and how much money they're giving. So the wealthy people are paying towards the dispensary operating. And then they're also getting money up here. They're getting it from other reasons. So the grand jury assesses the presentments. So from people paying their fines to the grand jury, some of that money is going and supporting this dispensary system. This is 1840, so this is before the Medical Charities Act comes in. So once we get the Medical Charities Act, it's the poor rate starts paying for these dispensaries. So instead of them being a charitable and that people choose to pay for it, they have to pay a tax. And this is one of the objections, well, one of many objections people had to the poor laws. It's like, well, the wealthy people like to choose the charities they're donated to, and the poor laws took that away. It says, no, these are the social services, if you like. They didn't use that terminology. These are the facilities we are going to provide to the poor. We're going to use the poor rate, we're going to use the tax you pay, and we'll distribute it accordingly. So prior to that, though, you have, giving £1 and £2 and things. They saw something like 11,000 patients that particular year, and that included 73 poor women were seen by a midwife. Now, yes, so that's... sorry now, as I said, it's not clearer, but there was so much information on that, and I just wanted to print it all. In 1840 in Nina, there was a midwife, and she was part of that dispensary system. When the Medical Charities Act came in, and they have a dispensary system in Nina, and they have one in they have one in Bursakane, and they have one in Templemore and Roscrea. There's no midwives employed. And when that dispensary system starts, initially in the whole country there are 10 midwives. They just didn't employ them. So if it was a poor woman who needed help during her labour and delivery, she either was paying a handy woman herself, or there was a couple of lying-in charities. I only discovered that while I was researching this. I think Tipperary Town and Clonmel had lying-in charities, so where women were funding a nurse. It was a charitable thing too. So, and they paid for a midwife to attend a poor woman. Deliveries really are happening in home. It's all home deliveries at this stage. It's the safest place to have a birth. We don't have any maternity hospitals in Tipperary, I don't think. Limerick had a maternity hospital again. It was Bedford Row, lying-in hospital. It was for the poor. But where you had a maternity hospital, you did have education for midwives, so they could do certificates. There wasn't exams until later on, and a standardised education, but there were people going to maternity hospitals and learning how to be midwives. So here we have nursing and midwifery as separate professions. So when I was training to be a nurse in the 80s, and then I went on in the early 90s to be a midwife, you had to have a nursing qualification to be a midwife. And in recent years, they've split those professions again. You can do direct entry midwifery, and back at this time, you could be a midwife standalone. You didn't have to be a nurse, and you could be a nurse. Well, you could always be a nurse. Midwives probably had, the handy women, the unqualified midwives probably had a little bit more respect and regard in the community because they were known in their communities and they were bringing forth the next generation. The nurses, as I said, were fairly low status. It was said that their job was like a low form of charing, which is a really low form of domestic service. You get to the 1860s and you start getting germ theory. So medicine and scientific research is coming on, and they realize, okay, we need better sanitation. Doctors are highly qualified, and then they want obedient and intelligent and educated handmaidens, as we used to be. And they wanted women to support them, and they wanted someone who was qualified. So doctors were clamoring for education for nurses. As I said, other women, philanthropic women, were looking for respectable jobs that women from the middle and upper classes could do. Now, what ends up happening is those women end up getting jobs more as supervisors, and the jobs then go to the next class, which were really farmers' daughters and the daughters of businessmen and parents from the army and the military and the Gardaí and that sort of thing. It's probably similar to today. There was a lot of competition. You see this in England in particular. I'm sure it happened here a bit. If anyone's read much Charles Dickens, and there's a character in one of his books, Martin Chuzzlewit, called Sarah Gamp. And Sarah Gamp became the poster child for the worst midwife you could ever possibly find. And even though she was a fictitious character, she was used in all the propaganda to kind of encourage qualifications for midwives and to get rid of these slovenly, loud-mouthed, vile, gin-swilling women who wouldn't look after you anyway. There's pictures of her, sitting with her feet up at the fire, smoking and drinking gin. So this was kind of a picture that was put out there, and this Sarah Gamp character, and that she spread disease. So kind of narrative going on to try and encourage education for both midwives and nurses, and also that, especially when it comes to the poor laws and the infirmaries and the dispensary districts, that the poor law guardians would employ only qualified staff. And this is where a lot of the poor law guardians start having a little bit of an argument with the local government boards, because the local government board is coming up with this ruling based on a lot of pressure. There's a Workhouse Reform Association forms in 1896, and they have about 7 major things they want. They want better food for inmates, they want the elderly to be treated better, they want sick people and children to be treated better, but they want to get rid of pauper nurses and for the Board of Guardians to only employ qualified nurses. And the Board of Guardians don't want to do that because that's going to affect the amount of money in the coffers. So Florence Nightingale, we've probably all heard, she was a great reformer, so she was looking for all of these things I was talking about. Elizabeth Fry in the 1840s, really starting to talk about we want qualifications, and we want this to be a respectable job for women, and to open up. The 1860s are really a period of time where they're starting to look at, can women work outside the home, and what respectable jobs are there for them? Female philanthropists are pushing for reform as well, for the reasons I've just said. Then we start getting a growth in the religious orders in Ireland, and we had 2 orders in Ireland and that were what they called walking nuns. Every other order, like the Presentation, were enclosed orders. But you had two orders of walking nuns, the Sisters of Charity and the Sisters of Mercy. And both would have established themselves in Dublin with hospitals. So you have the Martyr Hospital and you have Vincent's, which was in St. Stephen's Green. And when Florence Nightingale was preparing to go to the Crimea, she came to Dublin and she approached the Sisters of Charity and she asked them to train her as a nurse. But they refused at that time because they only did nurse training for women who were going into the order themselves. And the same with the Sisters of Charity. They only opened their nursing schools in 1891. So we're not talking about a very long time ago that you have kind of nursing schools. But one of the first nursing schools was Sir Patrick Dunn's in Dublin, and that was for Protestant girls who were trained to be nurses, opened in 1861. You start having examinations for midwives in 1870, but it wouldn't be until down here in 1918 that we actually get legislation that to be a midwife, to work as a midwife in Ireland, that you needed to be qualified. So not until 100 years ago did we actually have legislation that says you couldn't work as a midwife unaccompanied without a qualification. But you start getting qualifications here a few years earlier. And then the standardization of the nursing training only comes in the 1890s. So we're talking of quite a recent history. And then all of these recently qualified nurses and midwives, they want jobs. And those jobs are predominantly in the workhouse infirmaries. So this is some of the advertising. So this is from a magazine called The Nursing Record from 1888, and they're saying 50 years, what a difference it makes. So this is the Sarah Gamp type character with her crossover apron and her mop cap and not looking too neat and tidy. And then you had the modern nurse, the 1888 nurse, and this is basically the direction we want to be going in. So I had a look at, with all of this, I had a little look at the census, 1901 and 1911, they're fantastic resources, and to look at how many women returned themselves as being a nurse. So we had in 1901, in Tipperary now, this is just all of Tipperary, 401 women returned themselves as nurses. But when you break it down, see this section here, the 260? The age group here is between the age of 12 and 80. So these weren't working in hospitals. Most of these were in domestic service, maybe looking after children in a house or looking after the elderly in a home, but they were employed in a home setting. This group here, it was not clear what kind of nursing they were doing, and only 96, so only a quarter of that 401 nurses were actually medically trained nurses. So it was a small number for the county. Then we have slightly more of them. So here, this whole number, there's about 470 nurses people returning themselves as nurses by 1911. You still have about 50% of them are working in domestic service, so not nurses. So that term nurse was very broad. It's a lot more definite. There's a lot less of this unknown number, and then it's this almost half are now qualified. So we're seeing a difference in society as well. So more girls are going, and it is predominantly women who are being trained as nurses. In the psychiatric hospital in Clonmel, you will see a lot more male nurses. So this is what I mentioned here, so we're going to get onto the dispensary system here. So in 1853, when this dispensary system was establishing around the country, you had 10 midwives employed in the system. That's across Ireland. By the time you get to 1916, that has increased to 789 midwives. So we have a significant development in midwifery and employment opportunities for midwifery, and also all of this is to try and reduce the amounts of maternal deaths and early infant deaths. That's part of it, but it's to have midwives available to the poor. Just out of interest, so I've mentioned kind of the poor law unions and the dispensary districts, and I'm not sure how clear that is. So for South Tip, you have these are the unions, and here you have the dispensary districts. And within that, this is all the new cases that were attended every year. So I think I have that number. I think it's about 4,000 or 5,000, and that's new cases. There's a thing called, so there was a red ticket and a black ticket to see the doctor. The black ticket allowed you, so it was written in black ink, and you could get it from one of the guardians. You could generally, somebody who ran the local shop or the pub might have the tickets. They might have the ability to hand them out. And if it was written in black ink, you had to attend the dispensary. You attended the doctor in the dispensary building. And if you got a red ticket, so in red ink, he'd come and visit you in your house. So as you see, no, there's still quite a few that get home visits, a lot less than attend. So that's just the numbers. And then this is 1903, so by 1903, there's nearly one midwife in each dispensary district. But this is the population, so you had now not everyone's going to be eligible for the services, but if you look at Clonmel, the population of Clonmel in 1901 was 11,000, and there's one doctor, one medical officer, one apothecary, so somebody who's making up medicines, and one midwife to service. And between them, they saw 585 new patients in the dispensary, and they did 469 home visits. Just fairly extended, it's a fairly demanding kind of a role. And the doctors are getting about £100 a year for that job, and the midwives between £20 and £25 a year. Then in North Tipperary, then we have just the 4 dispensary districts, and we have, the 4 unions, and there's the dispensary districts. And again, the numbers came up here. So there you have 5,500 dispensary visits and 2,500 about. So there you've got nearly 8,000 visits undertaken by 20 doctors, 1 apothecary, and 19 nurses, 19 midwives. Just out of interest. So this is some of the ads. I think some of the language in the advertisements that are in the newspaper can really let you know what's kind of going on. I think these are both from, one's Clogheen here from 1895. So this is this period of time where we're starting to see a real push to have qualified staff. So you mightn't see it there, but the chairman is saying here that they've decided that there was 4 votes in the Clogheen Dispensary Committee, and they've decided that they're going to appoint a midwife, and they're going to pay her £22 a year. And the chairman says, I don't see that we have anything to say to the proceedings of the committee. And then Mr. John Mulcahy says, have you a qualified midwife in care? And the chairman says, yes, but she is only paid 5 shillings per case and 2 shillings 6pence car hire, where the distance is over 2 miles. I am afraid the Clogheen Committee are setting a bad precedent, he says. So he's saying the rest of them, whereas they then say that in Callan, the Callan guardians are paying £26 a year. So there's in a lot of the minutes of the boards of guardians, you'll find a lot of discussion about finances. They don't want to pay more than they need to pay. But equally, we see that the midwives will move to where they'll be paid more. So I love that part as well. So and then in Clonmel then, and this is 1899, and so, they've decided that they're going to appoint a qualified midwife for the district at a salary of, is that so many shillings per, 15 shillings per case, which includes all expenses. So that's, these are the decisions, and they're advertising then in the local paper, and then they're getting the applications, and then they're making decisions. So as I mentioned, my main research for my master's was in North Tipperary, so I have much more detailed information about some of those midwives because I went and researched them further. I love doing genealogies, and I love finding out about people, and I became very fond of these women, even though I haven't got a picture of any of them. And it's maybe that nature, a bit like Maria Luddy spoke about, that for until 20 years ago we weren't writing about women, but these are the lives of very ordinary women, and maybe photographs weren't taken in their lifetime, but at least maybe their stories, we're pulling out the stories a little bit. Now this lady here isn't the midwife. She's Mabel Dease, and herself and her husband were, she became an MBE. She was originally from Athy, and her husband was from Mount Mellick and from Laois, but they lived in Neenah for a good while, and they were very involved in efforts in the First World War, especially with the St. John's Ambulance and Red Cross, and she was involved with the sort of women's welfare in the munitions factories, and got an MBE for her work. But she also was one of 2 lady guardians they had in Neenah. So mostly the guardians on the board were male. Until 1896, a law was passed that women could be elected to the board, and in the early 1900s, Mabel Dease and Margaret Pole, both from Neenah, were appointed to the board. And I think the term was 3 years, and she sat 2 years. By the time she was finishing up, then around 1911, she was getting she soon got involved in her war work. But this lady was a great advocate for the first qualified midwife they had in the Nina Dispensary District. Her name was Rosaleen Waterson, nee McCormick, and she was originally from Meath, and she was married to a jockey in Kildare, and she was only about 20, and he was 21, and they were married a year, and he died of tuberculosis. And she trained in the Coombe, and then she applied to the Nina Union in 1902 and was appointed as the midwife for the dispensary district in Nina. Now, she had a very busy district with a lot of poorer people, and she was only on £20 per annum, which was less than, as we saw, Callan and Clogheen were paying more. The average in North Tip was £25 a year. Now, the dispensary midwives, that's what they got paid for looking after the poor in the area who were entitled to free care on the red or the black ticket. They could also take on a private business, but Rosaleen Waterson said her problem was she was so busy with her poor patients that she didn't have time to take on private business, but also because she was going into some of the poorest houses in the area, the wealthier women who could afford to pay her didn't want her. And Mabel Dease was always advocating for her, saying, look, she's a really good nurse. She's improved conditions considerably, and she's gotten rid of the liquor that used to be very common at the child bed. So it kind of gives you, obviously alcohol was used either for pain relief or maybe it became a social occasion, but the qualified midwife got rid of the alcohol around the birth of the child. So she was a midwife there from 1902 to 1919, and then she left to get married to Arthur McCarthy, and Arthur at this stage had 9 children and had been widowed twice, and his youngest child was 10 months old. And then she died only in her 50s in 1931. And then this is where I get some of this information about these midwives. So if anyone's done any genealogy, they'll recognize these birth registers. And this little column here, it usually is filled in, it's whoever reports the birth. And so it can be the mother, the father, somebody who lives in the house, or the nurse. And so we have here Rosaleen Waterson, Nina, and it generally says, they just say Nina, Summerhill Nina, that's where the dispensary was, and present at birth. So they're not always recorded. Sometimes it's just the mother or father's name there, but it's a lovely place to go looking for the midwife. Maybe if you're looking at family records, you can see, did they record the midwife who attended? This lady as well, I find she was the first recorded dispensary midwife that I find for North Tipperary, so 1894. She left Clonmel. The woman was from Clonmel, and she came to Tumivara and Nina. She had been married to Edward, who was only 40 when he died. He was a printer from Abbey Street in Clonmel. And she had 5 children, and they all went to live in the dispensary in Tumivara. Sometimes the midwives lived in the dispensary, generally only a 2-roomed building. They were paid for caretaking, and they were given enough coal to light the fire on the days the doctor was there seeing patients. But after that, they had to pay for it themselves. She retired after 20 years of working in 1914, and she never took a day's leave, was what they said in praise of her. Never took a day's leave. Now, she wouldn't have been working as a midwife every day, and she did have the job at the dispensary, but it meant she didn't leave anywhere. Like, she was available. She had to be on call if a woman was pregnant and could deliver at any time. So she mightn't have been physically working every day, never took a day's leave. I always find that fascinating. And then when she retired, her daughter, who at this stage was married a year, she replaced her as the midwife. And you see that in these stories about these midwives. You'll find Rosaleen Waterson's niece ended up being a midwife. And here we have Anne MacDonald's daughter as a midwife. I found sisters, lots of generations of women then that follow on in the same profession. So the type of case, so Rosaleen Waterson had so she saw about 87 ticketed cases in 1915. Whereas you come down here, there's Mary Donoghue. She's only talking about 17, and Portrue, that was divided between 2 nurses, 17. So they're not seeing huge numbers. Now, Portrue had a lot of problems in that there was a lot of unqualified midwives working in that area, and they didn't want these qualified midwives coming in, and they were quite vocal, I think, about that. But these were the ones that were employed under the poor law, by the poor law guardians. And an average, so with each of those deliveries, the midwives were making between 3 and 5 visits before and during and after the birth. Then this particular midwife I never met, but I feel a connection to her because her daughter ended up being the midwife after she retired after 47 years of service. And her daughter was known as Nurse Ahern, and Nurse Ahern delivered my mother at home. And then I ended up being the babysitter for Nurse Ahern's great-granddaughter when I was a teenager. So and there's been a long history in that family of nursing and midwifery. So Helen Bennett ní Redden was from Rathcabbin, and by the 1901 census she was a widow with 2 boys. I think her husband had been in the army and he died overseas. She was actually the midwife in 2 districts. So she did Terryglass Dispensary District and Bursacane for 10 years until the Board of Guardians said, no, you can't do that. Midwives have to live in the district that they're working in. And actually she fought it and she got a compensation. She got a higher rate of pay per year. So I said, fair play to her. She married again in 1907, had 2 more children, and one of those was Mary, who married, and her married name was Ahern, and then she became the midwife then, I think, probably working up until the 1970s. Nurse Kelly transformed their home into a nursing home. So my grandmother would have attended that nursing home for her first delivery in 1945 and had the rest of the children at home. So you could go and stay in the nursing home and be looked after the midwife in her house and then go home afterwards. So that was Bursacane. Now we go back to Clogheen. There's a lot of information in the newspaper, especially the Munster and National Advertiser. Has a lot of information about the South Tipperary unions. So this is only in 1863, and they're looking for a hospital nurse. We're kind of getting onto the nurses in the workhouse now, so that was the dispensaries, and that's generally midwives. Now, initially, when they're employing nurses in the infirmary and the workhouse, they're looking maybe for a midwife. There's not a lot of deliveries happening in the workhouse. They're still happening predominantly in houses, but there's a few. So some of the early nurses that they do employ with a qualification is the midwife, and they just let the rest of the nursing be done by the pauper nurses. But here they're actually looking for, so you've got a salary of £20 per annum. They're actually looking for a qualified nurse in 1863 to work in the hospital. They get the £20 per annum. They also get food and apartments. They call it rations and apartments. When I trained in 1988, there had been a big health budget cut in 1986, and student nurses in my time got paid. The year I started, they had reduced the student, I think I got £50 a week, and it had been reduced from 100, and we got free food and free accommodation. And so it's kind of returning to this. We had the same type of conditions, not conditions, but our accommodation and our food was included, and then you got an amount of money as well. So the guardians will give a preference to a candidate who possesses a midwifery diploma, and in the event of all other qualifications being considered equal. So they're looking in 1863 in Clogheen, they're actually looking for someone with a midwifery diploma. And then here, they're in Clogheen, they're also looking for a trained nurse for night duty in the workhouse infirmary at a salary of £35 a year, and I think it's 9 shillings a week in lieu of rations. So they're not feeding her, but they're getting extra money towards her food. And the term trained nurse shall mean any person who has resided for not less than 2 years in a general clinical or other hospital recognised by the local government board. And there is this distinction made by the local government board between a qualified nurse, who's someone who has a qualification, and a trained nurse who then has a couple of years experience under their belt. So that's 1911. And then this is one of the first nurses I came across in Nina, and again it shows you kind of some of the conditions that the inmates in the infirmary are experiencing. So Nurse Malloy had been the nurse. She was a qualified midwife, I think, did have a nursing qualification, worked in the workhouse in Nina. But there was complaints about her several times that she was drunk on duty more than once. And when she was brought up in front of the guardians, she didn't deny having taken drink. She said, but I wasn't drunk, I'd only been drinking porter. But porter, whiskey, brandy, liquid opium were all available in the workhouse because these were all used as treatments. There was lots of medications available actually in the workhouse. And I think the whiskey and brandy in particular for chest complaints. Dr. Minute in Nina was quite happy to keep people in the infirmary and having that treatment for their chest complaints, but the Board of Guardians they kind of copped on and said, I think they're only there now for the whiskey. I don't think they need to be in the infirmary anymore. So she resigned then in April 81. And the Board of Guardians at this stage had said, you know what, if she leaves, we'd like to replace her with nuns. We'd like the Sisters of Mercy to come in. And so they advertised for applications for the post, and the Sisters of Mercy and Nina did apply for the post. They actually specified in the ad that this would also be open to the Sisters of Mercy, and they applied and they got the post. But it took a year for them to do the building that was needed in Nina to create a small convent for 4 nuns to move to the infirmary. And during that year, Nurse Malloy stayed on and was working in the infirmary. So during that year then, Sisters of Mercy had established themselves in Nina, and they were involved in education. And they were living up near where the jail is in Nina now, in the courthouse. And they had primary schools and secondary schools, and they had been visiting the poor, and this was going to be their first foray into nursing in Nina. So they hadn't been nursing, so they went off to, a group of them, went to Tipperary workhouse to learn how to manage a workhouse. The other nurse in Nina, in the fever hospital, wasn't qualified, Bridget Reynolds, and she replaced her mother, who was also Bridget, when her mother died, and she married the workhouse schoolmaster, but when he retired, he wasn't allowed to live in the workhouse anymore, so himself and the 2 children had to move out. He got sick. She snuck him in, and she was found out, and she was sacked for trying to look after the husband, and he died about 6 weeks later, and then she emigrated to Australia. So really interesting stories when you dig down into the women. So from that period of time, so from that kind of late 1800s, when through to when the workhouse closes, essentially in the 1920s, nursing in Nina in particular is a real issue. So there's either too many nurses, not enough nurses. If there's a fever, and then Dr. Minnett then, who's the Joshua Minnett, is a little bit of a maverick, and he kind of ignores the Board of Guardians and does his own thing. So if he feels that nurses are needed, he actually hires them from Cork Street Fever Hospital in Dublin, brings them down the train, or he gets them from Barrington's, and the Board of Guardians is in uproar because how are we going to pay for it? And he said, we need them. And there was no accommodation in the workhouse, because when they were built that the work would be done by the paupers. And so when you start having a lot of staff coming in, it's like, well, where are we going to house them? So when there was no one in the fever hospital, the nurses lived in the fever hospital. When there was fever, they had to move out, and sometimes they were putting them up in hotels in Nina. Other districts don't seem as bad. I was looking up Claheen and Tipperary. Some of them are using much more ward maids rather than qualified staff, and they seem to have accommodation around the workhouse grounds, so whether they've built stuff or whether the workhouses aren't as full. So I mentioned the Sisters of Mercy. Now, it's very hard to find good pictures. This is from Corrafin Workhouse, and you have the 2 Sisters of Mercy managing the workhouse, and there's an inmate there. So nuns in the workhouse was really a really important factor of improving the lot of the inmates in the infirmary. Because, as I said, prior to that, you have these pauper nurses who aren't really interested in the job, they have no medical training, and they really don't have a lot of facilities. The Sisters of Mercy in Limerick tried for a long time. They had been visiting the workhouse and visiting the poor, and they said, can we come in and take over the management of the infirmary and just improve things? The Board of Guardians was very reluctant to let them do that, because the workhouse system was actually non-denominational. They were very afraid to have one very strongly Catholic group coming in and maybe proselytizing, trying to convert the Protestant patients that were there. This was the thinking at the time. But eventually, anyway, they got permission and they were allowed into Limerick. And they did such a good job that steadily over the next 40 years, you end up with half of the workhouses in Ireland having the Sisters of Mercy or another order of nuns, mostly the Sisters of Mercy, managing the infirmary part of the workhouse and doing a very good job of it. And then for Tipperary, we had them in nearly all of the areas. So not in Bersicane. Bersicane had Sisters of Mercy in education, but the workhouse was quite small. They didn't do any of the nursing there. The first Sisters of Mercy come to Tipperary. They come to Tiptown in 1874. Then by 1877, 4 sisters go from Doon, move to Thurles to improve the lives of the poor, is what it was said. In 1879, Sisters of Mercy take charge in Carrick-on-Shore workhouse at the request of the Guardians. In 1882, then, I mentioned the Sisters of Mercy, that the 4 or 5 nuns that set up a community in Nina. Then by 1883, they've arrived to work in Clonmel Workhouse Infirmary, and the last was 1885. You have the Sisters of Mercy take charge in Claheen Workhouse. And when most of these workhouses close, the ones that end up having district hospitals, like Nina, it's the sister that was the matron of or in charge of the infirmary, becomes the matron of the hospital. Do you know that there's that continuity there? So by 1903, you have the Sisters of Mercy are in 84 workhouses throughout Ireland. And this woman, Miss Catherine Woods, she was a member of that Workhouse Reform Association that I mentioned. And what she said about the nuns coming into the workhouse is that the nuns had brought sweetness and light into many of those places, so the workhouse infirmaries, and there was no desire to drive them out. But a nun who was not trained in nursing the sick could never take the place of the trained nurse, because Catherine Wood was still on the thing of, no, we need the nurses to be trained. And actually, a lot of the nuns who took over the management didn't have nursing qualifications. There was an argument then made in a lot of workhouses under local government boards saying, well, if you're managing a workhouse, you don't need to be a nurse. It's only those who are doing the nursing. But what did happen when the nuns went into the workhouse, so they brought a lot of advantages. They definitely improved sanitation and order, cleanliness, stock control, so there was less of the whiskey and the brandy and the medicines going astray. The behaviour of the inmate nurses, so those pauper nurses, behaved better and looked after the patients better when the nuns were there. The disadvantages is most of them weren't qualified nurses. They didn't do night duty, so they generally worked from 7 a.m. to 9 p.m. every day, but then at 9 p.m. they left, and then the workhouse infirmary was left to the pauper nurses. They couldn't practice midwifery. It was banned by canon law until about the 1950s, and they were forbidden from some types of care of men and some surgeries. So there was some disadvantages, but as managers and as the matrons, they were excellent. But it meant that the Board of Guardians still had to employ nurses. They also, that reform committee advocated that the boards of guardians would put forward some money and allow the nuns to go and get the extra nursing training they needed. In some areas that happened as well. This is just an example of a workhouse infirmary, and this is a children's ward. On Christmas Day, if you see down the bottom there is Santa Claus, and we have some holly and that around, and this is a children's ward. They've all got their heads bandaged, I'm not sure why, and that was in Belfast in 1906. This woman fascinates me, I think, nearly above most of the women that I found, and I think possibly because her life story is in such parallel what's happening at a national and an international basis. Like many of the other women I've already mentioned, she was a widow. So there's a lot of young widows in this. So she was born in Dublin in 1869, and see those houses? That's not the exact house. I think hers was one way or the other. Her father worked for the railway, and so these houses are in Great Western Square in Dublin. She lived in one of those houses, and she lived in one after she got married as well. So there's like this terrace of red brick houses, and that's where she lived. So she married James Turner in 1887, and it looks like James Turner was about the same age as her father and seemed to have been a lodger in their house. And then 2 months after they got married, their first child was born. And then they had 5 children in 8 years, and James got tuberculosis and died when he was only 48, so leaving her a widow with 5 young children. Now, her father and mother lived 3 houses away from her, and I think her mother died, but her father was a great help to her. So it seems, I'd say she was only 18 when she got married. I don't think she had a midwifery qualification then, but seems to between 1895 and 1897, when she got the job of the midwife in the workhouse in Nina, seems to have acquired a qualification. And she applied to the board when she got the job to see could her 6-year-old daughter Alice join her in the workhouse, and she was given permission. She hadn't mentioned that she had 2 older daughters and 2 younger sons. And in the 1901 census, the 2 boys are living with her father in Great Western Square, and the 2 older girls seem to be in a boarding school / orphanage in Mountjoy Square. By 1902, she has remarried, and she marries Michael Doughton, and Michael Doughton's from a family of, I think his father and all his brothers were RIC, and they were from Ballynunty in Tipperary. And they had 4 daughters, and one of them died as an infant, Henrietta. And then some of her older children by this stage, by 1902, have moved to Nina. And she then she'd left to work housework, but she was working as an independent midwife until they left the town in 1922. Because her husband was an RSC constable, when the RSC was disbanded, they lived in Nina for a short while, and then there was one particular night, one weekend in June of 1922, and all the ex-RIC families were told, get out of Nina or else there's going to be trouble. So they had to leave. So they left with definitely their 3 younger daughters and they fled to Liverpool. And before that happened, Alice, that we mentioned up here, Alice was working as, I think, a secretary. She got influenza during that influenza pandemic of 1918-19 and she died. And then said they left and they went to Liverpool, and only 4 years after leaving and arriving in Liverpool, she was not an old woman and she died in 1926. I just think her life really reflects, it's a real snapshot of maybe how world and national events can affect the life of one woman. And then this is just showing her there where she's working as a midwife. And this is, one of these is where she's also the mother. Margaret Doughton, I think, is that it there? Henrietta, and that's the little girl that died. But that's her birth. So she was 5 weeks old. I think she got gastroenteritis, but like her mother is back out working within a month of her being born as well. This is just showing, as I was mentioning, by the time we get to 1920, it's just showing the numbers that basically most people who are using the workhouse are using it for healthcare. And then this is showing the types of, so Tipperary Town Workhouse, based on the census records, the type of thing that people are entering the workhouse with, like the infirmary. A lot of chest complaints, a lot of rheumatism, some with phthisis and tuberculosis, but you'll have burns, injuries to the eye, injuries to the leg, infectious diseases, lots of different illnesses there. And then we get to the 1920s. As I said, most of the workhouses close. Most of them aren't needed except for the hospital part. And we have 2 county schemes, one for North Tipperary and one for South Tipperary, that come about in 1924. And then it's how they're going to reuse the workhouses and the workhouse system and still provide relief for the poor. So a lot of us think, I was always told that the workhouses closed in 1922 when we became a free state, and that was it. But actually that wasn't right at all. So what we ended up getting is the county home. The county home is really the workhouse reimagined, and then some of those are for the elderly, and the one in Thurles here was also, it says it's for people who are chronic invalids and people who have intellectual disabilities and unmarried mothers, whereas in Roscrea you have medical, surgical and maternity cases, so that becomes a district hospital. You also have a fever hospital in Roscrea, the district hospital, so our current hospital in Nina, was there from that time, and then you also get a hospital in Thurles. And then for South Tip then, you have a lot more, so you have, again, certain number, you've got the county home in Cashel, but you have district hospitals in Clonmel, and in Cashel, in Clogheen, in Tipperary Town, and in Carrick-on-Shore. And then you have a couple of fever hospitals in there as well in Clonmel. So it did continue, and that is the basis of our modern hospital system. So it did all start with the Poor Laws. We'll go to it. There's not that many slides in it, actually. There's not as many in it. I didn't want to, so the district, yeah. So I mentioned that, so Women's National Health Association didn't start district nursing, but Lady Aberdeen, that's this lady down here in the corner, her husband was the Viceroy of Ireland from 1905 to 1915. They were from Scotland. And when she was in Ireland, she had come from Canada, and she was on the Women's Council over there, and she was also an advocate of nursing over there. She came to Ireland and said, I want to do something to help the Irish people, and she could see that tuberculosis rates were very high. They were actually higher in Ireland than they were in, say, other parts of Europe, and that had been an escalating thing. We had fairly standard rates. Tuberculosis has been around, they say, since before the pyramids. Tuberculosis is a very old disease, but it was escalating in Ireland. She wanted to do something about that and about maternal and infant deaths, and so she started things. So she started this organisation called the Women's National Health Association. There was 180 branches around Ireland. Now you have people like in Nina, Lady Denali, and I think there's another I think Cashel had a very well-known lady of that community involved in it. So they tended to be from the middle and upper classes, but they did an awful lot of work in fundraising. So you'll see ads in the papers for fetes and concerts and all sorts of drives. And what they did is they fundraised and they paid for a nurse. And the nurse then was responsible for visiting the homes. And said tuberculosis in Ireland, we mentioned tuberculosis, but it was, as I said, it was one of the top 3 killers up to in the early 1900s. And then I think in 1901 it was the worst, it was the highest cause of death, about 10,000. But it was that Women's National Health Association and all their fundraising, they built Peamount Hospital. So it wasn't the first sanatorium in Ireland. There was one in Wicklow before that, but they had built this. Now, when it was built first, I think before they opened it, local people went in and knocked some of the buildings, burnt some of the buildings down because they didn't want that number of people with infection living near them. It's just looking at other things. So there's all looking about fever. So, I forgot to say smallpox. Smallpox was actually one of the bigger ones. So smallpox, measles, scarlet fever, diphtheria, whooping cough, fever, diarrhea, and dysentery and cholera. There's some of those kind of fever type diseases. So they're quite high as well in terms of causes of death. And then the puerperal fever and the tuberculosis. So yeah, you have up there the 10,000. So that's the one actually more than the pregnancy-related issues. The tuberculosis takes a little bit longer to reduce, but it is reducing. And really, until we get antibiotics, and I think first of all, I think it's the streptomycins. Until we really get antibiotics, they don't see any major improvements in tuberculosis rates. One of the Lady Denali in Nina was like, she was working in all of these areas and doing lots of voluntary work. She had one daughter, she had 5 children. I think by the time she died, only one of them was alive, and that was a son. One had died in the First World War, and her daughter, after 7 years of bringing her off to the coast every summer and bringing her to Europe, and she died in her early 20s of tuberculosis. So, just being wealthy wasn't a protection either. So district nursing associations didn't need to be set up by the Women's National Health Association, but they often were. Before Lady Denali, the previous Viceroy's wife was Lady Dudley, and she was also involved in getting district nurses, but that was for the Western Seaboard, so for the poor areas on the west coast of Ireland, whereas the focus of the Women's National Health Association was more around eradicating or reducing TB. But in Tipperary, we had district nursing associations in Carrigan-Shore, Cashel, Clonmel, Feathered, Kilcooley. Some of these were later, like the 1930s. Usually the nurses were employed for 3 years, and then there was always a struggle to find the money. When it was a thing of fundraising to try and pay the nurse, they were always short. But then down the line, later in the 1900s, you have a mother and child welfare scheme comes in, so a little bit of money goes towards the nurse for that, and there's tuberculosis schemes, this kind of insurance schemes come in, that helps pay. And by the 1960s, you see the county councils taking on the role and paying for the public health nurse. So the modern public health nurse started with these district nursing association things. So she's taking on a mother and child role as well. Then in Carrick, they had a health week. So, see, we have in 1913, and they're going to tell people all about how to be healthy and eat well, and they're well supported, all these things. Now, these are the ones I find interesting. So these are the Queen's Nurses reports. So this one is for the first Queen's nurse or district nurse they had in Nina. So she was employed, this Mary Alice Doyle was employed in 1908 as the district nurse for Nina. And it kind of, again, I know it's not very clear here, she was actually born in County Down. I think she was educated in Cork. Her father was a ship's captain. She trained in the Mater, and she did her 3 years training there, and she did her midwifery, and then she did all these extras. She went to St. Lawrence's Home for the 6 months training, and the dates are there. And then it would say, like it tells about that, she was a good cyclist because they had to ride a bike, and the other courses that she had done. And then when she was employed, so here it says it here, she was employed in Nina and the dates, and then I think she went to Clondalkin after that. You can't see there, but it sort of tells, these are the inspectors that are coming from the Queen's nurses, inspectors, and to see how the nurse is getting on. And with some of these reports, I found they'd say, oh, she's a nice nurse and she's kind, but she's no initiative and she's not great at working on her own. And some of them, they say she's great. This girl was well regarded. So she was Nina. And then this Margaret Mary Scannell, she was, I think, in Cashel. And again, I think this girl's not a cyclist. So I'm not sure how she worked as a district nurse when she wasn't a cyclist, because usually, they had their bag and the bike was given as part, their accommodation and the bike was given as part of the job. I got those. They are available. They're from the Wellcome Trust, all the Queen's Nurse role information, and I got those through Ancestry.com because I'm a member, but I think you can get them through the Wellcome Trust as well. They're wonderful records because you get a real snapshot of the nurse's life. And also, you know, all those personal things of what was she like, the patients like her. They have all these things. You know, she's neat, she's kind, she's hardworking. They have all this information about these nurses. Thank you very much.